My name is Dr. Sonia Nayyar, and I'm a double board certified neurologist that practices here in Apple Valley. I'm California born and raised, and so very happy to be back in Southern California. And I just kind of wanted to spend a few minutes to talk about COVID-19 and kind of things that we can do to protect ourselves. I mean, I know we've all been greatly affected by it. We've missed weddings, birthday parties, social events. There's a lot of things that we've missed, and it's affected us physically, mentally, financially as well. But the reality is that from a medical community, we're quite confident that this will not just disappear. So I want to talk about what our next coming few weeks, months, and maybe even more may look like. First, I wanted to take a quick step back and talk about why did we do this kind of stay at home or shelter in place. And really the reason, one of the main medical reasons that we did it was, or that we recommended it, was that we wanted to prevent an overwhelming of our healthcare system. Unfortunately, even before COVID-19 came in, we were already functioning at our max capacity. And once we learned about how contagious it was, we knew that if we all were exposed by doing our normal activities, we would inundate the healthcare system, and we would probably collapse our healthcare system, leaving a lot of us without the medical care that we would need if we were exposed. And what we do now worry about is, as a county, we've actually done a fantastic job of staying at home, and our numbers are not as terrible as it could have been if we didn't shelter in place. But the concern is, what do we do when the shelter in place is lifted? And the concern from a medical community is a second wave of infection. And the reason is that there's a lot that we don't understand. Unfortunately, we don't even know that if you've been exposed to COVID-19, are you immune from getting it again? There's cases in South Korea of a reinfection. We don't even know that if you were asymptomatic, does your body build enough immune against it that you don't pass it on if you get infected again. And unfortunately, in the medical community, there's been a huge lack in testing, and there's a huge delay in testing. I'm sure between all of you, you may have either known someone or you yourself have concerns, and the testing takes a while, and we're just not up to par to really let everyone go back out, because unless we're able to test widely, get the results quickly, and perhaps even trace people who have positive to make sure that their people that they interact with are tested, this may cause a second wave that could be the same effect, it could be worse. And then lastly, I'm sure you've heard hospitals, essential workers, we just don't have the proper personal protective equipment to keep us safe. And that's a huge concern, as I'm sure all of you are struggling to get masks either for people you work with or your own family members. So what can we do to stay safe in the next few weeks or months? Even as I expect the stay at home and shelter in place to be lifted over the next few weeks, I still highly am encouraging my patients, my family members, and my friends to still practice social distancing. And I don't just limit this, I tell everyone this. There are case reports of newborns being affected. There's case reports of 90, 100-year-olds being affected. So this disease doesn't really spare anyone. And especially if you're over the age of 60, if you have any chronic medical conditions that require you to take immunosuppressants, if you have diabetes, you have asthma, or if you share a household with someone with this, I still recommend that we practice some form of social distancing. There are things that are easy for us to do. Practice good hand washing and good hand hygiene that we've been doing, really limiting how often we go out to unnecessary events, whether it's family events, sports events, going to the mall. I know that we miss them. We're all suffering in this together, but at the end of the day, it's really your life online or the life of a loved one if you pass it on without even knowing. So I know that all of us just want to hug our family members, see grandchildren, see family members, see friends, get back together to your normal meetings, as I'm sure you guys do. But I think that as of right now, because there's so much uncertainty, even if the stay-at-home shelters are lifted, for your safety and your community's safety, I really suggest that we continue practicing social distancing. And just the last thing I kind of want to leave everyone with is that if you are sick, if you feel like you have a fever, flu-like symptoms, shortness of breath, don't go to the ER immediately. Call your primary care doctor, call your ER doctor. A lot of our offices actually have protocols in place to address it prior to going there, and then at least we can direct you the right place. A lot of offices, including my own, we've been doing telehealth, and I'm affiliated with Choice Medical Group, and most of our offices have telehealth as well to try to figure out who's truly sick and who's not. So, I wanted to give you a few words about how we can stay healthy during this time. I want to say thank you to Kathleen and, of course, the Rotary Club for giving me this opportunity to speak. And if we have a few minutes, I'd love to answer questions, concerns, or even comments about this.
Wow, that was fantastic. I really do appreciate it, Sonia. And I know how busy you are. I should say, Dr. Sonia, my apologies.
That's okay.
So my apologies. You've earned the title. So I'd like to turn it over to anyone who may have some questions.
This is John Kazera at St. Mary's. I have a question. Thank you so much, Dr. Nayyar, for your feedback. And I think you're right. From a hospital standpoint, we 100% agree that we need to remain cautious, because if you look at past epidemics and pandemics, there's this second wave fear, and sometimes it's stronger if you look at the 1918 flu. So the one concern, I just want to make a statement, the one concern that we have at St. Mary's is that we've seen a significant drop in emergency cases. So people that are having strokes or heart attacks are not going to hospitals right now across Southern California, and that needs to change. And so we are working hard to educate the community that hospitals are still a safe place to go if you're in an emergency. And so we want to make sure that people do still go when they're in an emergency situation, but alternatively, if they're not, to do exactly what you said. My question is I've seen some new research that says, knowing you're a neurologist, I've seen some new research that might suggest that one of the side effects of COVID could be, especially for younger patients, strokes. So have you seen any of that research, or can you speak to the risk of stroke as a side effect of COVID?
Yeah, absolutely. I think that's a great question. And, I definitely reiterate, we've seen an increase in our outpatient of patients calling for things that we would normally send them to the ER for, because everyone is scared. So I agree. If there's a medical condition that cannot be addressed by your specialist or primary care doctors, the ERs are still capable of taking care of it and are absolutely doing their best to keep everyone safe. But second of all, you bring up a great point. A lot of people, when they originally were looking at studies out of Italy, studies out of China, they were talking about how this is a disease of the elderly, 60, 70, 80-year-olds getting the disease and dying from it at a higher rate. But what at least the US studies have shown, and remember, they're quite preliminary. So the studies that are coming out are very small in quantity. The power of the studies are low, but what we have seen is that there's an increased number of a pro-clotting type of disease, meaning strokes and heart attacks. A lot of young people are having strokes and heart disease that are occurring that don't have the normal risk factors. So there's a lot of studies that are going into about if we need to give blood thinners to these patients. Are there things that we can do preemptively to try to prevent it from happening? But absolutely, we're seeing it in other things outside of just cardiology and neurology, even skin manifestations. There's a article that came out recently that talking about the dermatological findings, and basically they're getting tiny strokes or tiny clots that are going to the fingertips and toes as their only symptom of COVID-19. So I think there's a lot to learn from this, but absolutely, if you have symptoms of a stroke, absolutely, that's an emergency no matter what the situation is, because as you know, we have medications that can treat strokes if we go quick enough to the hospital.
Yeah, thank you.
I have a question. The newspaper reports there's 19 cases of COVID-19 in Apple Valley. I think most of the population of Apple Valley thinks the risk is so small that they're ignoring the stay-at-home requirements. And so, what I see is the only way to solve all this is to have a universal testing, to test everybody and see who the carriers are and who they have contact with. Is that correct?
So I absolutely agree with you, sir. Actually, New York just came out, New York City, I think, just came out with a study where they tested patients, and 20% of the people that they tested were asymptomatic carriers, meaning, yes, absolutely, we could have had COVID-19 and had very minimal symptoms, chalked it up to allergies or a common cold, or, you know, there are studies talking about only the GI symptoms, only dermatological symptoms. So yes, I think a lot of us are asymptomatic carriers, and what's worrisome is that, one, we know that people who are asymptomatic carriers, meaning they don't have symptoms that they make them go to the hospital to get testing for, but at that time the virus shedding is quite high. So people can spread the disease at that point. I mean, I agree. I you know, on social media, I do read a lot of people commenting on the percentage of our population that's been affected. And I think that you have to remember, one, for at least the people who have been following the stay-at-home shelter, you know, the closing of schools, closing of non-essential businesses, I think that's why our numbers are so low. But the difficulty with the widespread testing is just multiple things. One, the access to it. Two, how accurate are there? There's a lot of testing that tests the acute phase, but what about people who have been exposed to it in the past? And then it brings up that question I talked about. If you've been exposed to it in the past, are you immune to it again? So because there's so many variabilities in it, I agree with you, sir, that we need not only widespread testing, but we need increased access to it. And lastly, how do we interpret these data, and how can we get it back quickly? So I think there's a lot of difficulties that we have in the coming few weeks and months. We've made improvements, but you're right, there's a lot that we still have to improve from it.
Doctor, did you say you're with Choice?
Yes, sir. I'm affiliated with it, but I have a separate private practice in Apple Valley.
Right, but I think you even went to school with my children, perhaps. But
it's probably my husband. It's my married last name. So my husband and his brother and sister grew up here.
Yeah. You have multiple offices in several cities. Do you have in your practice or in Choice any ability to test for COVID of any of the different kinds of tests? Do you have any testing ability in your organization at all?
So you know, as a specialist, I can't speak for all the primary care doctors within Choice Medical Group, but from my understanding that yes, a majority of their primary care doctors won't have protocols about how to approach it, and yes, they do have testing available. I do think that their availability of testing is not as close to, let's say, how much St. Mary's has or Victor Valley Hospital or the actual hospitals, but they do have capabilities for the testing as well. Yes, sir.
You just hear about all these little machines, et cetera, but nobody ever seems to step up and say, hey, we've got one, because I'm sure they don't want to be inundated. But
well, so I mean, it's not only about not having it. It's like, for example, there was this huge, you know, everyone was so excited to hear about, I believe ABIT had the medical testing, but what people didn't realize is that testing that would leave the result in 15 minutes, it was one single test. Places like South Korea, the reason why they were able to test 20-30,000 people per day per reports is because their testing was testing hundreds of patient samples within 15 minutes. So we still have a lot to go, but most of the primary care doctors within at least Choice Medical Group do have capabilities of testing. I'm not quite sure about outside.
that's good to know.
Yes.
Thank you.
Absolutely.
That's very good to know, and I appreciate you sharing all this. Definitely an eye-opener. I do have a question. You mentioned something about maybe a second strand of this COVID-19. I don't know how much is really known about that. I mean, I know we have been involved with the eradication of polio, and every time you think that you're getting really close to eradicating polio, then you have the second strand, which is called the polio, the wild polio virus, which doesn't cause paralysis. It has completely different symptoms. So do we have any knowledge of what might be coming or what we might be expecting?
And, I think that's a very, very good question. And it's a difficult one to answer because this is a novel virus. It's unlike any other virus when we talk about its ability to mutate, its properties, how contagious it is, what it responds to. So, I mean, that's one of the concerns because we don't know what we're really dealing with or what's going to happen. We don't have any treatments for it. Everything that you hear, there's small studies that people are just really throwing everything that they can because we have 30-year-olds that are ventilated that our only next step is to throw everything we can at them in hopes that we can get them to improve before we take them off the ventilator. So we don't know what's to come. So from my standpoint, I'm a cautious type of person, so I like to be prepared. So even for me, I've advised all my patients, my staff members, everybody, that even if the stay-at-home shelters are lifted, it is better to use our caution, be smart, still practice social distancing to an extent, and we'll have to see what the weeks bring to us.
Okay. And this may sound silly, but we, as Kathy is aware of, we had our Rotary Youth Leadership Awards Camp for 10th and 11th graders that was scheduled in March. And of course that was postponed and now has been rescheduled for the end of October. So October 30th to November 1st, but you hear of this next virus that's coming in the fall. And, we put a lot of work into this camp. We have like 375 students, I believe, that are registered to go to this camp. And we're just wondering, do we put a lot of effort into it or do we just cancel it for the year because of the unknown?
And look, I wish I had a crystal ball for you to tell you what's going to be coming, but what you're talking about is this fear that from a epidemiology standpoint, for the most part, viruses do tend to peak with other viruses, meaning the winter season. So October is usually when we start to see our normal influenza flu cases as well. And so it's worrisome because I'll say we don't know what to predict. Personally, and this is from a personal standpoint, I wouldn't anticipate any major event going on for the rest of the year. I mean, I've told most of my friends and family members, you have trips, you have major weddings, postpone it. I mean, we ourselves, we've canceled 3 major trips throughout the end of this year because I have that much fear about it continuing to be a problem. While it might not peak as badly, but I think it's going to be hovering in our community for quite some time. Either 1, until we find adequate treatment, or 2, until a vaccine, which is quite far away.
Thank you very much. I will definitely share that with, no, that was great. Thank you. I will definitely share this clip with our committee and our current district governor to maybe have them rethink this.
Yeah.
So, but thank you very much. Does anybody else have any questions for Dr. Nayyar? Well, thank you very much, and stay safe out there, and I hope that you will join us again for future updates.
Absolutely, I would love to. I'm always available. Just let me know, and thank you again.